going on, guys? Welcome back to my channel. If you're new here, welcome to my channel. I'm Amanda, also known as Cake and Weights Online. So today's topic is a fun one for me, honestly, which, I guess the experience wasn't that fun, but I'm going to be talking all about my surgery that I had last year. Actually, literally, this whole story is like a year old. It occurred June of 2020 to October of 2020 was this whole process with me going through finding like a lump in my breast and then deciding to have it removed even after I knew it was benign. So we're going to get into everything, and this is great for anybody who might be like preparing to have any sort of surgery like this or going through the process of like figuring out if it's benign or cancerous and what all that entails, because I went through like a lot of the process along the way to figure it out, and then also just if it is benign, should you get it removed, should you not, what's going on with that, because I was like lost, I wasn't sure if I should, and we'll get into all of that. So I guess without further ado, I'm going to get into it. I just have a few things written down because there were like a lot of steps along the way, and like I said, this is a year-old story, so I don't want to forget anything. Also, this is probably going to be a little bit of TMI as I get into this, which I guess you can expect with any finding a lump in the breast story. So just letting you know now that I am going to be very open with this. So again, let's get into it. So a year ago, I actually did also journey off birth control. So this kind of happened simultaneously with that. Now, I don't think that it was related because I started feeling an itch on my breast, and started feeling the itch before, I think it was like before I was off birth control, so I do not think that they're related, but it is very interesting that it kind of like coincided at the same. But it could have definitely been due to birth control. Like the doctors don't usually say stuff like that, but I honestly wouldn't be surprised because I was on birth control for like 9 to 10 years. That does take a toll on your body, your hormones, and I have a whole other video on that, so I won't get into that here. But starting I think it was May of last year, it was either April or May, I started feeling like an itch around like my nipple area. So I just kind of ignored it because I was like, it's just an itch. Like maybe it's the weather's kind of changing now, so maybe that's it. Like the heat is kind of like getting to me. That's never happened before, but who the heck knows? Maybe it's that. But to remedy this, I love Vaseline. I put on my lips as chapstick. Like that's my thing. So I like put Vaseline on it because I was like, that's gonna help. Like I thought it was dry. It was kind of like not peeling, but like dry, and like white stuff was coming off because it was dry, like dead skin. So I put Vaseline on because I was like, oh, it's dry, let me put Vaseline on, and it did help. But one day when I was putting the Vaseline on, I felt a lump. Now, my mom had breast cancer, my mom's sister had breast cancer, so I was kind of like, crap, I have breast cancer. Like, when it was itchy and I Googled it and it said cancer, I was like, haha, well, that's not me. But when I found a lump and the itch, I was like, oh gosh, I gotta go to the doctor literally right now. It's 10 p.m. at night and I gotta go now. But I went to sleep. Right when I woke up, I showed my mom, like I was like, hey mom, can you feel this for me? Like I need some help. She said that she didn't think it was anything, but I was so worried. I called I called the doctors that day, and then they sent me into the gyno. I got an appointment that day because I was so nervous that they just fit me in, and she said she didn't think it was anything, but again, since I was nervous, she said, let's get you an ultrasound so that we can just rule it out, and then you don't feel nervous anymore. But she said from the feeling of it, she's like, I don't think it's anything really. So I didn't get an ultrasound that day, but I got one like next week or 2 weeks from there. I can't really remember the specific dates, but it was like a week or two out. So I got that done, and she had like the doctor look over it, like the person who did the ultrasound had the doctor look over it, and the doctor called me, this is all during COVID too, so this is like a very interesting thing, because I like kind of just put off all my appointments, but this was so urgent I had to get in. So I guess, I don't know if the doctors would usually come to the room or just do like the call anyways. I don't really know. But I'm sitting there, I'm on the phone, the ultrasound lady's on the phone and the doctor's on the phone, and she said that it was a little concerning, like the way that the ultrasound came out. So she's not really sure. Like from one angle, it doesn't look like anything to be worried about, but from the other angle, it could definitely be, cancerous or something to be concerned about. So they said, let's get you in for a biopsy. At this point, I'm like, oh my gosh, I definitely have cancer. Like, oh my gosh, hurry up. Like, we got to get this done now. Let's do this. So of course I had to wait again another week or two. I hope that you can tell from this story that I'm not good with needles or any sort of blood being drawn or anything like that. So having the biopsy, I was like, I pass out. Let me just be very transparent with you guys. I pass out like at the sight of blood very often. So I was like, I'm not going to drive myself. This is July, I guess, when this has happened. So yeah, the initial thing was in June. By the time I gave the biopsy, it was July. Andrew literally just went back to work. Like, I don't even think it had been a week when my biopsy was scheduled. So I wasn't going to ask him to drive me because like he literally just got off or just got back after being off for COVID for like a month or two. So I asked my dad because I was like, I'm not driving myself. My dad was working from home with the lockdown and everything, so he was like, yeah, I'm free, I can take you that day, I'll just schedule all my meetings like later in the afternoon or whatever. So I went in the morning to get my biopsy. Actually, it was like 1 p.m. It wasn't the morning at all. I went at like 1 p.m. to get my biopsy and did not pass out. I literally told them, I was like, I'm going to pass out. Like, I'm not going to do very well with this. I just want you to know, like, that's what's going to happen. And then she was very like good with me and calmed me down. And the person that was like guiding with like, so they kind of do like an ultrasound just so they can see what's going on and where to like do the biopsy. So they do that while she's like kind of going in and like, I guess they mark spots. I can't really remember all of that. I wasn't really paying attention. Like I wasn't like, hey, what's going on down there? So the lady that was like doing it held my hand, which literally was so helpful. So I needed that. They were very good. And I didn't pass out. It was weird. I don't think it hurt really. But it was just like, you heard a click and you felt something and it was weird. So I did that. Took like a week to get the results back. I'm telling you, my stress levels were so freaking high that week. Like I was like shaking at random times when I started thinking about it. Like it was not good. So if you are in that situation right now and that's why you're watching this video, then I feel you and I get you. And definitely just do things to take your mind off of it and try to do some self-care. Here at Cake and Weights, we're all about self-care. So go ahead and do something like that just to calm your nerves and to ease yourself. So after the biopsy, I got the results back in like a week and they were benign. So I actually like called them because I was like, I'm supposed to get my results today. Can you guys please give them to me? But I guess maybe let me kind of go back with the biopsy. So there was just like a little, Andrew watched a video later that night about like what they actually did to me. But I did not want to pass out, so I did not watch that video. But they did put like, it was kind of like a Band-Aid stitches, I think is like kind of what it's called. It's like just like a piece of tape almost. But it like, I don't know, it has like a mending property. I honestly have no idea, but it didn't require any like stitches or anything. It was just like a little like hole incision, like a little poke mark, I believe. I don't really know. I did have a little mark there. I think it's gone now. I did have a little mark there for a little bit, and that's where they put like the little Band-Aid stuff on. And I wasn't allowed to work out like the next day, or I think for 2 days after that, which sucked, because I actually got it done. I remember I got it done on July 3rd because the next day was the 4th of July. and so we had off. So I was like, darn it, I can't get a workout in and I have the day off. Rats. But after the biopsy, they told me it was benign. So I was like, cool, awesome. They said you can still get it removed if you want. Let's set up a meeting with a surgeon so you can talk about it. But it was like, I don't want to go in because, like, it was still COVID, and I didn't have to talk to them. And I honestly didn't think I was going to have surgery. So we just did a video visit, and at that point I was like, no, I don't need it. Like, I asked a few questions, but I was like, no, I don't need it. So then after, like, it was like almost 3 months after the biopsy, July, August, September. Yeah, it was like 3 months after the biopsy. I was like, the lump is growing. Like, it's getting substantially bigger. Like, it was probably the size of a pea, I'd say, before. And then it turned into, like, the size of, like, a lima bean, or so. Like, it was definitely, like, an inch or so big. So, with that being said, I do not have a lot here to work with, so any little, like, increase is pretty substantial for me. So yeah, it was still growing. I still felt like it was still, like, dry. I don't know. I think it was kind of painful at times too, and I wasn't sure if that was the biopsy or not, but they said that it should be fine after 2 to 3 months. Like, I shouldn't feel any effects. It should all be, like, basically recovered from the biopsy. So when I went in to talk to another doctor about it, they said that is weird that it's growing, and after, like, the 3 months, you really shouldn't be seeing this. So why don't you really sit down and think about like, getting it removed? So I was like, yeah, let's just go ahead, schedule the appointment, like the pre-consult with the surgeon, and we'll just move forward on this process. I was going on vacation like a week from then, so it had to be a little bit delayed. So yeah, so that's that. So I had my surgery scheduled, talked to the surgeon. So the problem with this in particular that almost made me want to back out once again was it's very close where maybe I can, like, try to put an image on the screen or something, I don't know, but where the lump was, it was kind of, like, right around the nipple area behind, obviously, so my milk ducts might be affected by this. And obviously I don't have kids right now, so obviously I haven't had kids yet, which means that if they took some of the milk ducts, I might not be able to breastfeed at all. I might only produce out of one breast, or just because if one's not producing milk, then it might, like, signal to the other one, like, hey, no, we're not supposed to do this, so it's not going to do it on the other side either. Or there's, like, an even worse option that where they took the lump from will get, like, filled with milk, and then I'll have to get it drained or something. It's going to be a whole nother process, which I just kind of put out of my head because I was like, I really do want to go ahead and have this. So I just decided I'm going to do it. Worst case scenario, then I'm not the one responsible 100% for feeding the baby, and I'll be able to tell Andrew that he has to get up in the middle of the night too, So, always trying to see the best out of the situation. But, so obviously, like I said, I still don't have kids, so I don't know what the outcome of that is yet. We will see when I have kids. And one of the things that really did help me with this decision is some people just can't breastfeed in general. So what if I was one of those people and, like, something did happen where the lump just kept growing, which kind of get to that in a little bit, and then I just never got it removed because of that fear? Or what if that prevented me from, So there's so many what ifs that I was like, let's just go ahead and do it. So I stopped freaking thinking about this because it's on my head all the dang time. So somewhere in the middle of this, I'm just going to throw this in there. My doctor set me up with a genetic counselor. So we kind of went over all the history of, like, breast cancer, ovarian cancer, any sort of, like, cancers like that in my family. Well, I think we went over any cancers at all. And with my family history and some other factors, like the fact that I hadn't had kids yet, apparently if you have kids younger, I don't know what includes as younger. I didn't really do research because I'm clearly way over that hump by now. But if you have kids younger, you're actually preventing your risk for getting breast cancer in the future, which is pretty cool. So, 16 and pregnant, maybe it's not the worst thing in the world. There are pluses to that for sure. But basically the whole point of that genetic counseling was my risk for getting breast cancer was increased. So I think that she said the general population's risk is about 12% or so to get it. And I'm up at 25%. So once I turn 40, so in about 10 years from now, I'm going to not only have to have mammograms yearly, but I'll have to have MRIs or ultrasounds. I can't remember which one, but I'll have to have something, additional screening, so it's going to be an every 6 months sort of thing, so it's not at the same time every year, it's every 6 months after I'm 40, and I plan to live for a while after 40, so that's going to be kind of annoying, but no, I guess it's good to know. So that's something to kind of look into, if like you do have a family history of something like that, maybe your insurance covers genetic counseling as well, and you can kind of get an idea of what you do need to cover your bases so that you know any preventative measures that you do need to take at any time in your life, or if there's anything, like any other medical screening that you need to go through to, check out, make sure that it's not a thing that you're dealing with. So onwards with the story. So after I decided to have the surgery, I had to schedule in the surgery, and then I had to also schedule in like a tracker implant sort of thing. So they actually put like a tracker on the lump, so the day of the surgery it's not hard to find. What happens is they have a device that triggers it so that it you can hear a click 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 sound and know exactly where it is. So they put that in, and it's basically, they explained to me it's like the same process as the biopsy, actually even less invasive than the biopsy. Basically, I believe that they just stick like a needle in there that has the clicker, and then they just put it on. So this is where the story gets fun for me. So I went in that day. I think Andrew took me that time because it was before work. So he drove me, because again, I'm not driving after something like this. So he took me in. They tried to numb the area, but it hurt. Like I felt the needle and I was like, ooh, that hurts. And she's like, okay, let me just do it real quick so that we can get it over with. So she starts putting like the tracker in to the lump. Now I'm not really sure if they put it on or in the lump, but I don't know. She definitely hit the lump with the needle because she got stuck. So this is one of the most painful, this is from my remembering life, the most painful experience I've ever had thus far. She has the needle in and it gets stuck and I'm screaming because it hurts so bad. I'm literally screaming and crying, and I'm like, and I have to like have my arm up because I'm like in this like awkward position. I'm like, and I think that the same lady was there who held my hand before, and I'm like squeezing her hand. I'm like, but I'm like actually screaming. I just don't want to like scream right now because it's kind of awkward. It's really quiet right now. But it was so painful. I laughed about it after because it is kind of funny when you're not in pain like that. But wow, that was like the most painful experience in my life. It got stuck. She's like, I'm so sorry, this is taking a while, it's stuck, like, oh my gosh, I'm so sorry. It was honestly probably like 30 seconds long, but felt like 10 minutes. I was like, why is this happening to me? So I'm happy I can laugh about it now, but so that was my story. The reason that I got stuck was because she said that was like, your lump is very hard and very dense, like, I don't know what you got going on in there, but I've never felt anything that hard before. Usually it's smooth, comes out like butter. So that was interesting. Because I was like, wow. And you've worked with a lot of lumps before. So yeah, that was interesting. And Then I had my surgery, which I was so freaking nervous about. Also, I had to take a pregnancy test twice for the surgery, and I feel like I might have had to take it again for like something else, but I had to take it twice because I went and got it. We went away the weekend before my surgery. My surgery was on like a Tuesday, I think, and we went away that weekend, so I took it on Friday, and then they said, oh, it's invalid because you, like, it was like 4 days ago or something, which, while I came off birth control, I actually like just had my period. I know I told you it was going to be TMI, guys. I like just had my period. I'm like pretty sure when I took the pregnancy test, I was like, I'm still like on my period. This is crazy. Like, obviously I'm not pregnant. This is scientifically impossible. If you know anything about when you can conceive, I can't. So I thought that was funny, but I had to take it like literally right before my surgery. And for the surgery, I was not allowed to drink water after midnight the night before, I believe. So I think my surgery was again at like 1 p.m. or something like that. I couldn't drink any water, which if you know me, this is like the first time water's like so far away, but I have my gallon water jug and I drink like at least a gallon a day, so that was freaking hard. I couldn't eat, but drinking honestly was much harder for me. They did give me like painkillers before the surgery, and they were like, just drink as little water as possible. I was like, aw, this is hard. But I'm really getting lost in my story. Oh, but I had like the nervous pees, so I actually peed like 3 times. This is like so much TMI. I like actually peed like 3 times before my surgery, so they were like, oh no, we have to have you pee in a cup for a pregnancy test, even if it's a little drop, just get it out. I'm like, trust me, I can always have something come out. Like, I can always pee. Like, trust me, I go a lot. It's like a hobby of mine. So that was that. Obviously, the pregnancy test came back negative, to no surprise to me. But yes, I had that, and then I went in for the surgery so nervous. I was like so nervous, and all these doctors are around, and then somebody's like, when's your birthday? And I said my birthday, and then somebody else was like, one of the or like the doctors, or I don't really know, nurses in there was like, that's my birthday too. And I was like, oh, what up, birthday twins. And honestly, that's like almost the last thing I remember, because then they started giving me the sedation IV stuff, and I was in sleep land then, and then I woke up and I was back in my little curtain area, and I think the doctors were there, and I was like, hey, what's going on? Oh, and also fun fact here, like I told you, I do not like needles or anything like that. They asked if I wanted the flu shot, and I was like, yeah, and then he came to give it to me before, and I was like, actually, do you think you could come back after my surgery when I'm still a little loopy? So they came back after I woke up, gave me the flu shot, and yeah, that's probably like the easiest shot of my life, because I was like, okay, yeah, give me the shot, guys, I'm feeling good. I don't know, I'm trying to think of like a funny thing, but it's like not coming out of my mouth or head. Anywho, I'm like, I'm jamming, guys, I'm feeling good, what's up? So yeah, so basically that's where I was, and then Andrew came to pick me up. I like heard them calling him. They're like, we're gonna call your driver now, your boyfriend, to come pick you up, and I was like, okay. And I think they gave me juice. I was so thirsty. I drank that in like 0.2 seconds. And they're like, wow, you finished your juice? And I was like, yeah, can I have something else to drink, please? They might have even given me crackers, I think. I think I got some sort of food. But I can't really remember. But that was, quite honestly, when you're like sedated on a surgery, like, I'm not gonna lie, I don't mind it, because you don't feel anything and you're completely out of it. So not gonna lie, that was totally fine. So we're almost done with the story. Recovery from the surgery was like, I want to say I was walking dogs at the time. Not too many. I think I only had to take off 2 dog walks, because again, COVID, so a lot of people were home walking their own dogs. But we did have Nugget here as well. She's so cute. I don't know if you can see her all the way, but she's so cute. So I think I was back to walking Nugget like after 2 to 3 days. I took a whole week off dog walking, just, in case, because I actually walked 2 dogs at a time for one of the walks, and they pull a lot, and I was like, I don't want them to like mess anything up. So I took a whole week off from that, and that was fine. That worked out. Probably could have gone back sooner, but whatever. I took some time to walk Nugget and all that good stuff. And then I was back in the gym at about 2 weeks. I think I went like a day before 2 weeks. And I was so nervous to get back because I don't want to mess anything up. So I was going pretty light. But then the day I had a 2-week follow-up with the doctor, with the surgeon, and he said that everything looked good. I can definitely get back to working out. I can get back to like all activities. And it shouldn't be any issue at all. And he seemed like he was very impressed. So the way that they cut was right around the areola, so that you like can't really see the scarring or anything. Now I will be very transparent in the sense that just in case anybody is getting this surgery, it does misshape your breast. So there's definitely an indent in there now. And like I said earlier, I'm not working with a lot already, so I was kind of like, man, they took some out. I don't even have that much to begin with. Rats, that's not cool. I mean, I can tell that one is, or like the one that had surgery is definitely smaller when I wear certain clothes and stuff like that, but I really don't think that anybody else could tell. Like, they'd have to be staring, and like I said, there's not much to stare at down there, so I don't think anybody's really looking. I don't really have too many mindset issues with it, but I know I'm in like some groups after having that surgery. I'm in some groups to just kind of like, you know, in case anything happened or I needed some advice, which I did actually get zip up bras. I just got them off Amazon. I got like a pack of 5. It wasn't that expensive, especially for a pack of 5. Just after surgery, they were saying like, you know, it might be hard to like raise and lower, which I don't know, but it did definitely feel better to wear that. Cause yeah, like the scraping up, actually, that's probably why it would be like you're pulling it down over. Yeah, I can see how that would not be good. And actually after surgery, I think that they just did they did like internal stitches, I think. I don't know how they do that. I'm not a surgeon, so that's pretty cool. But they also put on those like strips again. Those like, I think they're called sterile strips. But they're like kind of like the Band-Aid that mends it all together again. Oh my gosh, I was talking about something, I can't remember. Yeah, so it does, oh right. I'm in some groups, and I know that it can be like a mindset issue with like, now it looks weird, this and that, even though like I'm sure not many people are seeing your breast on a daily basis, but I know it can be like a self-conscious thing. Now, to be completely honest, I mentioned a few times that I have not much to work with, so I kind of got over my self-consciousness a while ago, because that's definitely something I was self-conscious of when like in high school and stuff like that, and just being president of the Itty Bitty Titty Committee. But I guess just positive affirmations, like I always say, it really goes for anything in life. You can choose to love yourself, love all aspects, love your scars, love your differences, love what makes you unique, or you can choose to not love it. So I definitely choose to full force love it, even though nobody sees it, like Andrew and my surgeon, and I probably showed my mom too. They're the only people that have actually like seen it, so you know, it's not like I'm showcasing it off to the world. I did have a lot of bruising too, just to go over some more recovery. I had bruising. I bruise really easily, so I don't know if mine was worse than it should have been, but I feel like it took a while to go away. Like after like a month, it was like fully gone. It turned into like that yellow stuff and was there for like maybe like 2 or 3 weeks too, or like 1 to 2 weeks too. All right, what is going on, guys? So I'm sitting here editing the YouTube video, and I was like, I never actually mentioned what I had. So I wanted to come back on here and talk about the diagnosis a little bit. So when they went in for the original, like the biopsy, it came back like they weren't 100% sure what it was, but they just knew it was benign. So after, like I said, it like grew a little bit and I decided to have the surgery, they're like, okay, cool, when you have the surgery, we'll be able to like tell you exactly what it was, because we're gonna have more of the sample to cut up and assess. So it turned out to be PASH, P-A-S-H, which I was just looking up, and quite honestly, I'm probably just not even gonna try to say the word. Pseudoangiomatous stromal hyperplasia is what PASH stands for. So it's extremely rare. Let me actually see. It's like extremely rare because I Googled it afterwards and I cannot find it. So it's so rare that fewer than 200 cases had been reported since the late 1980s. And this article was written in 2018. So, what up? Super unique over here. We got some rare stuff going on. So, needless to say, there's not too much information online about it since it's so rare. But it's benign, and that's actually why, I'm gathering that's why it was so, so difficult for them to get the needle in and get the needle out, I guess, was because it was so dense. So that's like the one thing that I can see from online is it's a very dense lump. So yeah, I'm sure that not many of you watching will be having the same POSH diagnosis as me, as it is very rare. But if you do, comment below, because hi, let's be friends, let's start a club, you know what I'm saying? But thank you guys. So I just kind of like took out the other outro, so I guess I should say thank you guys so much for watching. I really hope that this was helpful, informative, entertaining, whatever you came to this video for. I hope that it fulfilled your cup for that need. And of course, do not forget to like, comment, and subscribe. It does help me out, helps my channel, and helps my ego, quite honestly, too. So thank you guys for watching, and I'll see y'all next time.